Most of us are simply prescribed Kegels postpartum, but in a lot of cases, this can make things worse because we can actually hold a lot of tension in our pelvic floor. The result can be painful sex, weaker orgasms, leaking, tailbone pain, heavy feeling down there, constipation, back and hip pain. Like any muscle, our pelvic floor functions most optimally when we can both lengthen and relax it and also contract it. It can be really hard to learn to relax and let go of the pelvic floor muscles, but I promise it is so worth it. If I could only prescribe one exercise to help relax the pelvic floor, this would be it. You're going to take a pillow, place it underneath your butt. Feet are going to go up on a couch. Neck is in a nice neutral position. Now, the key here is to really focus on the inhale. As women, we tend to grip and hold our tummies an awful lot. And so it can be really hard to learn how to get that breath down into your body. But I want you to focus on inhaling through your nose. Imagine your pelvic floor is a trap door. You're going to let that inhale go down, down, down into your body and open and relax that pelvic floor. Then you're going to exhale. You're not going to do anything active with your pelvic floor. Just naturally let it recoil. Again, the most important part is that breath down. That means you have to stop sucking in, let it go, and connect. This one is a great way to practice relaxing the pelvic floor because it's going to open up the low back. We can also use our hands to actively open up and release our glutes, which can also help release the pelvic floor. You're going to focus on that inhale again. I want you to feel your ribs expand out like an umbrella opening up into your rib cage. That overflow is going to go down, 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 and you can imagine that those sit bones are spreading apart as you inhale. Take a couple of pillows or a yoga block. And we're going to take a nice wide stance, feet turned slightly out. Sit on down so that you can relax on those pillows. Try to keep your chest as upright as you can. You have to let your tummy go. Yes, rolls and all. Let it go. Free it. Inhale deeply through your nose. Now I want you to imagine that breath going down, 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 all the way to those pillows that you're sitting on down below you. Again, as we exhale, our pelvic floor naturally recoils. We are not actively lifting it. This is about the inhale. This is about the relaxation. This is a favorite of mine because, fun fact, your pelvic floor can be tight on one side only. We always have a lot of imbalances. Same goes for flexibility. You're going to see my other hip flexor here in a minute is complete trash. So perfect example. Grab hold of that foot and use gravity to kind of pull it down and open up that hip. You're going to inhale deeply down into your body, releasing as you do. Hang out in each position as long as you need to.